You've probably heard a number of old wives' tales over the years. I mean, who hasn't? And you might not even have realized that some of these were old wives' tales and maybe not actually true. Well, have you heard of the fact that the supposed fact, if you cross your eyes, they'll stay that way? Or that sucking your thumb will cause you to have buck teeth? Or that cracking your knuckles can cause arthritis? These are mostly superstitions and old wives' tales and urban legends that have been passed down through generations based on who knows what. Well, today we're going to talk about some of these and debunk these myths and answer your healthcare questions here on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers, you, to send in your healthcare related questions and we go over them. My name is Dr. Kamaljit Kaur and I am a primary care physician here in Coral Springs, Florida. So let's get to it. Today's first question comes from Owen and he just reached out to us through our Facebook page. Owen asks, "Hey, Dr. K, I think I got an old wives' tale for you. I was pretty anxious as a kid growing up, and at around age 11, I started cracking my knuckles. My uncle Calvin caught me doing it one day and said if I kept it up, I'd get arthritis. I didn't know what arthritis was, but it scared me enough to stop. It doesn't cause arthritis, right?" Well, Owen, I think you and your knuckles are going to be okay. But before I give you my in-depth opinion on this, let's check out this video from our partners at Mayo Clinic.
Snap, crack, pop. Nearly half of us crack our knuckles, and some do it a lot.
Habitual knuckle crackers, and they crack on average more than 5 times a day.
Orthopedic surgeon Dr. Sanj KKaur explains that tribonucleation is the process of creating bubbles within the synovial fluid in our finger joints. The sound we call cracking is actually those bubbles bursting.
You've got bubbles within the joint and you're breaking those bubbles up. Just like bubble wrap, you're pressing them and the bubbles are bursting.
Studies show knuckle crackers have the same function, grip strength, and range of motion as those who don't crack their knuckles, although cartilage can become thicker in people who burst their own bubbles. And what would Dr. KKaur say to a person with this snappy habit?
I would ask them, what do their friends and family say? If they find it's annoying, then stop. But otherwise, if it's causing no pain to them, really, I don't think that there's any harm. I do it myself.
For the Mayo Clinic News Network, I'm Jeff Olson.
So that was a wonderful explanation on what is knuckle cracking and can it really damage your joints. I've never cracked my knuckles. I find it to be a little, it's not for me, but my husband does it and he does it a lot sometimes and it can be annoying. So it's actually true to ask your friends and family what they think about your knuckle cracking. And if they get annoyed, maybe you want to stop. But physiologically, anatomically, medically, it does not cause harm. Just like Dr. Knuckle was explaining, it is basically like bubble wrap in your joints. And I know how some of us really enjoy popping those bubbles on bubble wrap, but it doesn't really do any damage. Now, that being said, if you do it too often, or say you're going to crack your knuckles and you exert too much force on that joint, that process can actually damage the joint and the tendons that are involved. So while it's not really dangerous, you want to make sure that you're not doing it too much and that when you do it, you're not exerting too much force or pressure on that particular joint. So all right, let's get to the next question. And this one comes to us from Kate, who reached out to us from our YouTube page. All right. And today's about old wives' tale, and it's fun debunking those myths, but we do have some questions like this one from Kate that really isn't an old wives' tale, but it's very important to discuss. So let's get to it. Kate asks, "Hi, Dr. Kaur. I'm at wit's end and I'm hoping you can help me. I'm a 64-year-old woman with extremely high blood pressure who's tried every medication known to man, but they don't seem to work and actually make me feel worse. Doctor, what can I do?" Kate, I'm so sorry to hear that you're having a difficult time controlling your blood pressure. My heart really goes out to you because having high blood pressure is a complication and it could lead to other health complications. So I really hope that you can get it controlled soon enough. Let's talk a little bit about it though. Now, a full discussion on blood pressure would take a lot more time than we have today, but there are some notable points that I do want to go over. Firstly, it is physiological normal to some extent to have an increase in your normal blood pressures as you age. There's some theories behind this, one of them being as we age, the walls of our arteries naturally start to harden a little bit. And because of that, the blood has to exert a little bit more pressure to go through those arteries. Now, the changes and increase in blood pressure that you might naturally see as one ages are not significant. They may be a few points here and there. So it's nothing really, it shouldn't translate into you're going to get high blood pressure as you age. That is not normal. Now, additionally, whenever we do diagnose somebody with high blood pressure, one of the first questions we ask is why? Why is your blood pressure high? If you went 30, 40 years, 60 years with normal blood pressure, and then all of a sudden it started to increase, our first question is always why? Because we want to get to the root cause of the problem and try to treat that more than just treating the blood pressure, even though that's equally as important. Now, when we put people on blood pressure medications, there's a lot of considerations that we make: your age, your other health conditions, the potential side effects that you might have from a medication, whether or not, you want to take the medication. There's so much that goes into it. But it's very important to know that no matter what blood pressure medications we put you on, how many we put you on, there's a certain response that we expect to receive after you've been on those medications for a couple days and certainly for a week or more. And if you're not getting that response, then we got to go back to the drawing board and see, all right, what's really going on here? Why is your blood pressure not being controlled? Is there something going on in the heart that's causing the blood pressure to be high? Is there something going on in the kidneys? Those are the two main regulators of blood pressure in your body. So with your doctor's advice and maybe even seeing a cardiologist, you want to really start investigating and get to the why of this. And then you can start managing and having better blood pressure. Like I said, having uncontrolled blood pressure can lead to a lot of health complications. So I wouldn't want to see you experience any of those. So please do talk to your physician and get to the why so we can get you treated. Now, let's get to the next question. And this one comes to us from allhealthtv.com. And that's exciting because that's our very own website. This one is from Anita. And Anita asks, "Hi, doctor. I'm loving these old wives' tales. I got one for you. I went to school way up north where winter seemed to last forever. One day I was running late for class when my roommate said I'd catch a cold because my hair was wet. I did get the flu once, but wet hair wasn't the cause, correct?" Oh yeah, this is one of those very old wives' tales. And it's kind of fun going over these. I forget how many of them there are sometimes. And no, you did not catch the flu because of your wet hair. So let's begin by acknowledging that flu or influenza is caused by a virus. And though being cold can make you uncomfortable and maybe even decrease your immune system's abilities at times, it really doesn't cause the flu or any other infection to happen. There's no medical research or data that's proven that this is a direct cause, that going out in the rain and getting wet will cause you to get sick, or that having wet hair is going to cause you to get sick. Viruses and bacteria that cause infection require a lot more to invade your system and cause these illnesses. So while I don't necessarily recommend it, it's not going to make you sick. Now, in case you missed it the first time, here's another opportunity to find out where you can send us your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
So here's another question. This one comes to us from YouTube. And in our episode of Old Wives' Tales, here's another one that's not an old wives' tale, but is very important to talk about also. And this one comes to us from Asia. Asia asks, "I'd like to know, what are the most common golf injuries?" Hi, Asia. Firstly, I hope I'm pronouncing your name correctly. With somebody who has a difficult to pronounce name, I know that it can be not fun when somebody butchers it. So I do apologize. Okay, now as far as I know, the most common golf injuries are back injuries, hip injuries, shoulder injuries, and elbow injuries. But let's get into it a little bit. I'm glad you asked this question because a lot of people think that golfing is a low intensity exercise. I can't get hurt because I'm not really doing anything, just swinging, right? Well, for those of you who play golf, I'm sure you would disagree. There's a lot that goes into it. You're standing for long periods of time, sometimes in the hot sun. So that's exertional to begin with. And then sometimes, well, the weather, if it's hot, that's going to put some pressures on your body. But also the movements in golf. Some of those movements are drastic and quick postural changes that could pose risk of injury. So when you're swinging, there's so many things that happen. Think about it. Your lower back shifts, your elbow shifts, your shoulder shifts, your neck even shifts. And if those parts of your body and the muscles and ligaments that support them aren't fully strengthened and aren't flexible, they're going to be prone to injury and strain. And there's so many things that can happen. You can get tendonitis, you can get bursitis, you can even get a slip disc in your lower back if you're not well conditioned. So you definitely want to make sure you're stretching before and after your exercise. And then during the other days of the week when you're not golfing, you want to make sure you're engaging in other activities that are strength training, muscle building, and stability improving. So you always want to make sure you're flexible as well. So even though golf may seem like not much going on there, there's actually a lot going on there. So do take care and remain strong and flexible. All right, friends, it looks like we have another question and it comes to us from YouTube. And this one comes to us from Sunil. Sunil wants to know, hi, my little sister and I used to cross our eyes and make faces at each other when we were children, which would scare our grandmother. She would always say, if you keep doing that, your eyes will stay that way. Is that true? Oh, this is a classic old wives' tale, Sunil. I remember doing this as a kid. It's just silly fun, right? That we have with each other when we're playing with our friends. And I'm not sure where this one came from or its origins, to be honest with you, but it's been around for a long time. And even though a lot of people might believe it, it's really not true. Crossing your eyes frequently is not going to cause damage. It's not going to cause them to stay that way. Just like any other muscle, the muscles around your eyes, though, they are prone to injury. So say you're crossing your eyes and you do it for a long period of time, that causes a lot of strain on the muscles around the eyes. And then that can put them at risk for sprains, just like you get an ankle sprain or, sprain in other muscles of the body. You can actually get sprains and strains of the eye muscles. That can result in vision issues, that can result in eye fatigue, even headaches. So people who have frequent headaches and come into us complaining of them, one of the first questions we ask is, how's your vision? What are your eye muscles and movements like? So yeah, believe it or not, that has a huge connection there. But like I said, crossing your eyes and playing around and having silly fun as a child or even as an adult doesn't really do damage to those muscles. Now, on that note, do be sure to see your eye doctor at least every 1 to 2 years because you want to do regular vision screenings. You want to make sure that your eyes are healthy inside and out and that those eye muscles are working appropriately. All right, let's get to the next question. This one comes to us from our YouTube. Wow, our YouTube is just really popping today. This comes to us from Adele, and Adele asks, Dr. Kaur, my 21-year-old son Felix has had an inguinal hernia since birth. The doctor at the time suggested leaving it alone, which we did, but it's begun to bother my poor Felix, so he'll be going under the knife next month. I never asked at the time, but I'd like to know what causes a hernia. Hi, Adele. Thank you for the question and for sharing your story. We appreciate it. We never want to see our loved ones undergo any kind of pain or discomfort and certainly not surgery. I hope he does well. Now, did you know that more than 1 million abdominal hernia repairs are performed each year? And inguinal hernias make up about 770,000 of those? Yeah. So let's get a little bit back into hernias and what they are. Hernias are basically when the contents of your abdomen, let's say abdomen for this instance, the contents, say the organs or parts of the organs, the intestines most commonly, start to bulge through the abdominal wall. So for lack of words, let's try with a description. If this is part of your abdomen and this is your abdominal wall, for whatever reason, sometimes the abdominal wall starts to weaken. And when it weakens, it can separate. And when it separates, that's when the the contents will start to push through. You'll see it as a bulge or a protrusion. Sometimes you can even push it back in. I know that sounds a little, but you can. Now, it doesn't mean that there's anything significant going on at the moment, but it does mean that there's some changes happening that cause the contents of your abdomen to essentially spill out. Now, it's not something that we see all the time in people, but when we do see it, there's two main questions. One, why did it happen? And two, is it an emergent situation? Now, there's many reasons that hernias can happen. As we age, it could be that the abdominal walls are weakened, so they start to separate. It could be that at some point we exerted a lot of intra-abdominal pressure, and that pressure caused the separation to happen. And if we're born with them, it could mean that at some point during the development as a fetus, as a baby, the structures that normally make up that portion of the abdominal wall or the groin didn't fully develop. And because of that, it left essentially a weak spot in the abdominal wall. And that's when the organs do push through for one reason or another. Now, I'm so glad that he's getting this repaired because it can turn into an emergent situation. Sometimes those contents, when they go through the abdominal wall, they become strangulated. For instance, if it's the intestine, it can become twisted. And if it becomes twisted, that can actually be a life-threatening emergency. So you really want to make sure that it's being taken care of. On another side of that, small hernias, we do tend to leave them alone because one of the age-old sayings in medicine is, you want to help people and you don't want to do harm. You don't want to do unnecessary procedures. You don't want to give unnecessary medications. So unless we really need to operate on somebody, we shouldn't be operating on them. So with hernias, if they're small and they're not causing any harm, we can watch them and we can wait. And if they become an issue, then we go ahead and we try to take care of them surgically. So I hope Felix does great. I wish him well in his surgery and a speedy recovery. Looks like we have another question, and this one comes to us from Instagram, and this is from Maurice. And Maurice asks, Dr. Kaur, my Nana used to always say an apple a day keeps the doctor away. So we kids bought into it and ate apples both breakfast and lunch. And I'm embarrassed to say that I still do. I know they don't keep the doctor away, but is it possible to eat too many apples a day? Hi, Maurice. You must have been the apple of your Nana's eyes. She did give you some good information there. Now, while eating an apple a day may keep the doctor away for some reason, there are instances when you can eat too many apples, just like everything. You want to do it in moderation, right? Now, I want to say that the saying came about because an apple is a very nutritious fruit, and having a nutritious diet improves your health and lessens the chances that you're going to get sick and you're going to need to see the doctor. So it's probably why they always said an apple a day keeps the doctor away. But as healthy as they may be, apples do have some, eating too many apples does have some unintended side effects. So apples are very high in fiber, and that's wonderful. We love fiber. Fiber is the most magical nutrient that's out there for many reasons. But if you eat too much of it, it can cause some unintended digestive side effects, bloating, increase in gas, maybe even increase in bowel movements. And even though it's not really dangerous, it can be, annoying, honestly. So having too many apples, maybe not the best way to stay healthy. Now, apples also contain a lot of sugar and a lot of carbohydrates. Now, even though these are natural sources of those carbohydrates and those sugars, which are the best sources, and your body will digest them as it should, having too much kind of overloads the body. It increases your calories. It can cause fluctuations in your blood glucose and insulin levels, and that can lead to so many other health effects. So, again, as with everything, in moderation, try to have an apple a day. Maybe not too many though. All right, if you've got questions, we've got answers. And in case you missed it the first time, here's how you can send in your questions to us.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
So this next question comes to us from YouTube, and it comes from Petra. Petra asks, Dr. Kaur, I learned to speak English back in Russia by watching American television when I was growing up. We used to sit really close to the TV because the volume was too low. This wasn't a problem until we moved to the States and a neighbor told my parents that sitting too close to the TV would damage our eyes. Old wives' tale, no? Petra, thank you for writing in and thank you for sending in this question. Firstly, I love that you learned a second language. I think it's wonderful to learn multiple languages just because it increases our own knowledge and it's just cool, right? So just like sitting, just like crossing your eyes a lot, sitting too close to the TV directly does not damage the eyes, but it does put a lot of strain on the eyes. And like I said earlier, putting a lot of strain on the eyes and the muscles around the eyes can cause vision issues, eye fatigue, and then those headaches that we talked about. So it's not something that you want to do regularly. Now, we do recommend that you watch TV or computer screens or your phone screen at a comfortable distance or at an appropriate distance. And what's an appropriate distance? Well, if you look at TVs, there's different measurements for the size of the TV, depending on the size of the TV. But if you're talking about your normal TV screens or computer screens or phone screens, then you really just want to at least be at arm's length and at a comfortable distance where you're not straining. If you find yourself starting to squint or strain your eyes, that's when you know it's a little too close and I want to back it up a little bit. And remember, if you're somebody who needs to wear reading glasses and you're not wearing them, that can also put a lot of strain on your eyes. So you want to make sure that you're doing that and doing it appropriately. So be sure to watch at a safe distance and wear your reading glasses if you've been prescribed them. All right, we've got back-to-back YouTube questions, and this one is from Amelia. And Amelia asks, hello, Dr. Kaur. I got an old wives' tale for you that I know is an old wives' tale, but I still follow this rule with my kids. You need to wait an hour after eating before swimming to avoid cramps. Overkill, right? Hi, Amelia. Thank you for sharing your question with us. Okay, so the short answer is no. You don't need to wait an hour after eating in order to go swimming. The theory used to be that after you eat, your body turns into digestive mode, right? So all your energy and your blood flows to the digestive system so that it can complete its mechanisms and digest your food and get all your nutrients out of the food that you're supposed to. So the theory was that because that's happening, you don't want to engage in another vigorous physical activity because you might get tired, you might not have the right endurance to do the other activity that you want to do, especially swimming. But you know what? There's really no medical evidence that suggests that you need to wait an hour, 30 minutes, or what have you after eating. If you're eating a well-balanced, normal meal, it's okay to go swimming if you're comfortable doing so. Now, if you're at a holiday party or if you're at a beach party and you've had about 10 hot dogs and some potato chips and sodas and ice cream, and you want to jump in the water right afterwards, it might make you uncomfortable, so I would say avoid it, but it's not going to directly harm you in any way. All right, I think we have time for one more question, and let's see here. We have one that comes from Dirk, and Dirk writes to us from Facebook asking, Doctor, can you sweat out toxins through exercise, or is this a misinterpretation of how detoxification works? Well, the two main organs that are involved in removing toxins from our body, Dirk, are your liver and your kidney. And sweat, not so much. Eating a healthy, nutritious diet, drinking an adequate amount of water, and really avoiding processed foods, those are the best ways to remove toxins naturally from your system. I know there's all these supplements out there, and there's colon cleansers, liver detoxification, a whole bunch of stuff. Really, your body has its own mechanisms that work fantastically to do the things that it needs to do in order to detoxify yourself. Now, remember, the basis of this is you have to not put in junk in your body so your body can work appropriately, right? So you want to make sure, again, a whole nutritious diet, whole foods, avoiding processed foods, and getting enough water, because that's very, very important to help the kidneys flush out those toxins. Now, let's do another question. I think we have time for Uma. And Uma asks, hey, doctor, is it true that a spoonful of honey and some lemon juice can help soothe a cough? So, sort of. And the reason I say sort of is because some studies have shown that honey is actually better than a lot of those over-the-counter remedies for soothing the throat tissues when they're irritated. Now, when those throat tissues get irritated, that's part of the mechanism that sets off those cough receptors. So if you're soothing those tissues, then in turn, you're also reducing the chances of the cough coming on. Now, there's more that goes into a cough when you're sick, but that certainly is one way that could help. Now, on the same token, you have to be careful because it's honey, right? It has a lot of sugar. So you want to be sure that you're not doing too much of it, just like with the apples and really with anything else. So a spoonful, maybe once or twice a day when you're not feeling so well is great. Now, if you're diabetic, you want to ask your doctor about this one because you might have some different recommendations for how you should treat it. Also, if you have other health conditions, and you have a cold and you're having a cough, you want to always talk to your doctor before taking those over-the-counter medications because some of them can actually worsen those conditions. So always be careful of that, okay? But yes, honey is very, very helpful. And I personally prefer it because I'd rather do that than doing chemicals in my body, right? So natural foods are always the best. Well, folks, that's all the time we have for today. I hope you had fun, just like I did, debunking these myths. And we'll see you next time here on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.